Why don't you introduce yourself a little bit? I'm really excited to have you here. I know your education, your brains, everything that you've done, what you guys have built here at your eye specialist, and everything at American Vision Group, and all the amazing doctors we've have. Excited to get started with you. So why don't you tell them who you are, what's your education, why you chose your field, and let's get going.
Sure. Thank you for having me. When I look look today at where we started and where we are today, it's just incredible, even to myself. Um, we started with one small office, and here we are. Sitting here doing a podcast, and I never thought anyone would care to ask me questions like you're asking me today. So, um, in some ways, that's super exciting, and you know, um, we have a lot more to accomplish. So hopefully this is another stepping stone for us. My name's Anil Vedula. I'm a cataract and refractive surgeon. My journey started educationally at Duke University, where I studied mathematics and physics. And like we were talking about earlier, um, kind of in my third year studying Einsteinian relativity, I realized, perhaps this is not, my field, my chosen field. Mainly because I think that I realized, you know, um, uh, certain things about myself that I wouldn't be able to accomplish, had I chosen a field like theoretical physics, a interacting with people, b what my actual potential was, and so at that moment I sort of took a 180-degree turn, but not 100%. And I thought, well, what in physics, could I do that where I could actually help people, maybe more some real world applications. So I studied lasers. I went into the laser lab. And that's when I started to think, okay, well, lasers and, physics and ophthalmology and studying optics, this is pretty cool stuff. And perhaps I should kind of spend more time here. So I spent a summer in the laboratory, in the physics laboratory, studying kind of optics and laser physics. And the next year I came back to Duke and I said, I think, I'd like to pursue something in medicine, mainly because I want to understand, how physics can really apply to patient care and help people. And so that seemed like the most real world application. So I switched my majors to medicine and applied for medical school that next year. And um, so, fast forward a couple of years, I ended up choosing Yale for medical school, and I'm honored to consider myself a Yale grad for multiple reasons. I think the Yale medical system is incredible. I think it gives you, it plants the seed of what you need to be a great physician. However, what it does is give you this freedom, and the Yale system is all about this freedom. We're going to give you this core understanding, but we're going to let each person branch off and sort of examine different aspects of what they find most exciting about medicine. And so it was not really a rigid criterion. Everyone laughs. They say, "Oh, yeah, Yale, you don't have grades, you don't have tests," and it's true. For the first 2 years, we don't have grades and tests. But I think it's that independence and that understanding that everyone is here with this kind of energy to learn, and ultimately understand that it's that energy to learn to be able to provide either amazing patient care or advanced science in some incredible way that's going to make a real difference. And so it's that Yale's kind of backbone, I think, that has also helped me in that unique background from trying to study physics and studying lasers to now going into medicine and then ultimately pursuing ophthalmology, sort of brought the whole kind of picture together. So after Yale, I spent a year doing research at a Howard Hughes Fellowship at the Bascom Palmer Eye Institute, where I came down to Miami, and what an incredible place Miami is. Here we are. I think now some would say, if it wasn't always true, maybe one of the best places to be in the world. And I've embraced it. I love so many things about Miami culture. Just the infusion of kind of Latin American culture and the mainstream U.S., the Cuban population, everything that they've done, and all the great things that they provide for the community, and so you know it was an amazing educational experience. We got to do basic science research and I studied, ocular immunology, and I had some great mentors who really kind of drove home some of the things that I love so much about, bringing, bringing the world of science to the patient. And then I ended up going back, finishing my last year at med school, and then applied for residency in ophthalmology, and ended up coming back to Miami, and to pursue my 3 years of residency in ophthalmology and do a year of fellowship in cataract and refractive surgery, um, which was again another 4 incredible years, hard, hard years of learning, um, not as much kind of you know independent pursuits, because I think once you start your residency, or any sort of pursuit in medicine, but residency and fellowship in particular, you know, the Yale system works to a certain degree, but once you're in medical, once you're in your residency, you have to just learn the basics of how to operate, how to how to diagnose patients, and there's not that's one thing where you can read as much as you want, but you're not going to be able to just be able to be a good practicing physician until you've gone through those basic steps. And I think that's the beginning of I think everyone's journey. One of our professors said it best, and used to write in our what do you call it, analysis of how you did
Evaluations.
evaluations, right? So in one of our evaluations, you have the potential to be a great doctor. And in many ways, when you're sitting there at the age of 31, finishing your fellowship, you can be taken aback by that. But when you live in the real world, you're like, that's very true. Because once you open your practice, once you start to kind of become a real world physician, and that involves so many things. It's not just about spending time like, oh, I diagnosing something as quickly, or it's about how you are able to communicate that with the patient, listening to the patient, learning from the patient, being able to take what they're telling you and synthesize that material, and provide them a path that they can follow. There's some people who could follow path A, and others can follow path B, and you need to be able to kind of bring that all together, and then deliver a message to someone that they can actually execute to help themselves. The other thing, is also surgically. I think just as you get more experience, as every case you do, every kind of bump in the road that you've hit, you've learned something about how to do things better. And every new article you read, and every theoretical sort of scientific paper kind of guides you a little bit more. And in any case, sorry, that was a long-winded
No, I
response,
think
but
I love that because it's like ever since you were a kid, you've always been, fascinated with physics and fascinated by lasers and all of these different things. And now you play with lasers for a living and giving people, amazing vision, specifically with like laser eye surgery and cataracts and those. That's just like to see the circle kind of come together and to see all the it's the schools you went to are no joke, man. Those are the tops of the tops, and it's like all the experience that you have is it's no joke. So it's like what you the education you have, the experience of all those years. And I love the way you kind of mention how your interaction with patients isn't just linear. It's just actually listening to them. It's seeing what are they wanting. Obviously you're the one who knows the medicine, you're the one who's gone through all these years, gone through all this experience, but taking their input because they're the ones living with these either conditions or procedure, whatever you're doing for them, and being able to kind of bridge that.
and then there's the real world applications of something like that. For example, when someone comes in who wants to have vision correction, but they're no longer in their 20s, and they're having trouble seeing distance and read. And how do you kind of satisfy those goals? Like, you have to listen, you have to learn how to and see what do they do on a daily basis. Do they spend more time reading? Do they spend all their time on computers? Do they, when you get an idea for someone's lifestyle, what was their educational background? I often ask, are they a professor of physics? Because I would treat someone that way slightly different than I would somebody who's a grandmother who spends most of her time knitting and playing with the grandkids. Neither everything. I think the art of medicine is tailoring your treatment to the patient. I mean, if you can do that well, then you've achieved success. It's not about 2020 outcomes, despite what you may think. It's not about having zero complication rates. Everyone's will have a complication, and almost, maybe, you have less 2020 outcomes, but the goal is to get people, as they say in ophthalmology, 20 happy. You want to kind of satisfy their goals, and I think that part, explaining to them, and then getting there, that's the most challenging part of our job.
Yeah, I never even thought about it that way. It's really thinking through what in their vision are they using the most and making sure that they have that first and foremost if they can't have it all. So that's a really neat point that I hadn't thought about. Can you explain to us a little bit what is LASIK eye surgery? What is that process? How teach
Sure.
us about that, please?
So LASIK eye surgery, with the invention of excimer lasers and femtosecond laser technology, really kind of revolutionized ophthalmology. Other fields of physics too, and material sciences, but especially eyes. And I think that the key take home is we wanted to reshape someone's cornea. Cornea is the first kind of layer of your eye. Light hits the cornea first, and it's bent by the cornea. And we need to get that light as crisp as possible onto the retina, which is behind in the back of the eye. Light will hit a lot of different objects before it gets to that. But the two biggest, most important things that light will hit is the cornea and the lens. So in order for us to change, and the primary problem people have who need glasses is that either that image is kind of prematurely focusing in front of the retina, or is not going to be focused until you go behind the retina, um, which is a little bit of a more theoretical sort of thought there. But without delving too much into the optics, basically, uh, the goal is to get that light to focus on to the place we need it to. So either you can do that with contact lenses or glasses, or you have to do something to change the way that light is kind of reflected, or refracted, actually is the term, onto the retina. So one way of doing that is to fix the cornea. The second way is to do something with the lens. Well, those are two things that we do today. We can change the shape of the cornea, and that's LASIK surgery, or we can change the shape of the cornea a little bit as well as change the lens, and that is cataract surgery. So those are your two biggest ways to help people see better. And obviously, there's a lot of things that go into it in terms of your age and what would be best for you. But LASIK eye surgery is using this incredible laser technology to change the shape of your cornea. And in so doing, using excimer laser physics, you're able to shave off like micrometers of the cornea in such a precise way that you can, predictably, uh, put that light, the focus of that light onto the exact spot on the retina you need, and without creating heat and without melting your cornea. And so that's why it was such a revolutionary change. I mean, how do if you thought about doing that before, you would hit all these complications. But now with excimer physics, you're able to kind of get trim off just with such precision that actually to this day, LASIK surgery is so accurate. It's perhaps one of the most accurate kind of things we do in medicine in its entirety. The safest surgery across the board in medicine. I mean, a small biopsy has a higher chance of infection than the LASIK surgery, which is something that I think is really important for the listeners out there to understand that, it's super safe. And in the right hands, the complication rate is so low that, you know, almost you never hear about it at this point. Using all laser LASIK, for example, using laser to make the LASIK flap, and then another laser to reshape the cornea um, is probably like, I mean, the infection rate is, minuscule. In general, you're correct. I think it's because there's so little chance for an infection that it just doesn't happen. Plus, you're not using blades that need to be, put in the sterilizers and all that. And a lot of the times we were seeing infections from those blades. There are people who still use microkeratome blades to do LASIK flaps. I mean, that's not something we do in our practice, because we're very technology forward. In this environment, with each interface being changed, brand new interfaces per patient, and with all of the technology, the advancements, I think that it really is kind of something that I'm not nervous about for my patients. So I don't really talk about all the negative consequences of LASIK surgery because I just don't think statistically it's actually something that makes a lot of sense to discuss. I mean, would you in any other field discuss, there's a 1 in 10 million chance that, I mean, we talk about this with everyday jokes. Lightning could strike you. Every parent has heard, their child tell them back, well, well, lightning could strike you, or you could fall in your hot in your bathtub. I mean, at some point, like, if the risk is like that, I think that we have to admit that then it is an exquisite technology. I can walk you through a little bit of the LASIK procedure. So, typically, what there's two big steps for LASIK. One is to make make a flap so that you can lift that flap. And the goal of, I think, lifting the flap was that you could change the shape of the cornea in the middle of the cornea, and then people would heal much better and faster if you made that change in the inside as opposed to kind of ablating the surface. There's another procedure called PRK where you can reshape the cornea from the front of the cornea. I mean, you can reshape the cornea either from the front or in the middle. And so, um, a lot of times, those are the two big, um, sort of one and two in terms of vision correction is either PRK where you change the shape on the surface of the cornea, or where LASIK where you make a flap and change the shape of the cornea in the middle of the cornea. So PRK, when you make you change the shape on the surface of the cornea, there's a lot of other things that have to happen, and one is that it takes a lot longer to heal. There can be more pain involved. So most practitioners would prefer to do LASIK if a patient's a LASIK candidate. There's a lot of things that go into whether you're a great LASIK candidate versus a patient that we want to do PRK on. Um, when you think through someone shows up, like who's a good LASIK candidate, I think, someone who's above the age of 18, because the FDA will only let us do LASIK on on that. The femtosecond laser, which is the laser that creates a flap, is is approved for people above the age of 21. So theoretically, if you're doing all laser LASIK, above the age of 21 works best. But for example, our military patients who come at the age of 18, we'll do PRK for them because the femtosecond flap creation laser is not FDA approved. So we'll so most kids in the military will get PRKA because and then there's no flap. So um, God forbid you're in a hand combat situation or something, and you could be injured to your eye. You don't want another source of a possible error or having some dislodging of your LASIK flap. Albeit that's just statistically that's probably extremely low of occurrence. But so you really want basically you want to be the right age. You want to have a stable eye exam or prescription, and you want to not have really any big medical problems because obviously it's still a medical procedure, and healing is challenging when you have certain kind of predispositions. Um, and you don't want your eyes to be too dry going in or have problems that have nothing to do with contacts. Somebody in a certain range of prescription. So that range varies, and it's getting bigger every year and every new laser that comes out. But you know, you can be nearsighted to a certain degree, and you can be farsighted to a certain degree. But if I was to give one message, it's like that we have a solution for everyone. I mean, even if you fall outside those parameters, there's other solutions for you. So refractive surgery is for everybody. Vision corrections for everybody. LASIK surgery may not be for everyone outside of that norm. And then if you're not in that LASIK norm, PRK covers a bigger, range. And if you're not in that PRK zone, then there's other technologies available to you. And that's really the take home point. And you just need to find someone that has the kind of education and skill set uh, to help you in the best way possible. So when you're looking for a good LASIK surgeon, someone who's done a lot of surgeries is important. Someone who has the breadth, not just the depth, and that breadth is someone who does a lot of different surgical types of surgeries and sort of access to all the different technologies.
Yeah, I think that's really interesting. I didn't know that there were so many different spectrums of within how to correct the vision, what you can do. So it's like maybe LASIK might not be the right play, but we have other things that we can help you with.
I mean, oftentimes a real world situation is a patient walks in the door and they're in their mid 50s, and there's a lot of different avenues there, in this diagram of which direction you can take, and that's what the finesse of being a great doctor is, to be able to see what their visual needs are and how to get them there and how to do the least amount of surgical maneuvers as possible to get them to see great for the longest amount of time.
Yeah.
Because if doing LASIK today and then saying, hey, in 5 years, you're going to need a cataract seems like doing injustice to the patient. Why would I suggest that option? I want to do something that's going to help you see for as long as possible.
So is PRK considered a type of LASIK or no? Because that when I was doing some research, that was like one of the questions I found a lot was what is the difference between LASIK eye or PRK? If it was the same, it was just like a sub branch of it. How would you explain that to people to like,
So I would say, from a from a big perspective, I guess looking down from the outside, is that LASIK is most people's go-to surgery when it comes to making that decision. But LASIK LASIK is making a flap and then changing the shape of the cornea underneath it. PRK is removing the first layer of the cornea called the epithelium and reshaping that. With LASIK, visual recovery is quick. Within a day, most people get 99% of their vision. With PRK, it takes sometimes minimum 5 to 7 days for them to start to see better, and then the recovery can last a month, and if not a little bit longer. Within that, there's subtleties, obviously, which would make you perhaps a good candidate versus not, based on the prescription you have, the thickness of your cornea, the shape of your cornea, and all these things, and your profession, as we said, military versus, a civilian. But ultimately, I think that's our sort of job as LASIK surgeons, is to see, when you come in to kind of walk through all of those different options. But I would say in general, if I think about that, PRK, you can use PRK on more people and less, and probably LASIK on less people, because with LASIK, you need a certain thickness of your cornea, and PRK, that thickness could be, you could have a thinner cornea and still do PRK. Um, PRK has a couple things that, make it a little bit worrisome if you have a large a prescription. So ideally, if someone walks in, I would choose LASIK. If it was my eyes, I would choose LASIK if I'm a good candidate for LASIK. It's if I'm not a great candidate for LASIK, then I would look at what other options there are.
And if a patient were to come into our office to get LASIK, what is that process looking like from the beginning to the end? From the consultation, they call us up. What is that process looking like?
So, there's probably a few different ways a patient can find us. One is a referral from their own physician or optometrist. So then, if they are referred from the optometrist, they obviously follow a slightly different path. But let's just take, for example, the person who picks up the phone and calls the office. You get first, you'll have a welcome message from our call center, and as soon as you say, "Hey, I'm calling for interest in vision correction or LASIK surgery, or PRK, even whatever key terms you use," you'll be sent to the or one of our patient care coordinator. The first person you touch will talk to you a little bit about kind of what your goals are and what your age is. And if you have the more information you have, the better, because we can help triage you in the best way possible. Um, so basically, you'll be addressed with the patient care coordinator who will set up the time for you to come in to have your consultation. In our offices, several doctors do preoperative consultations, so it's possible that you can meet me, and if that's what you'd like, for sure, we'll make it happen. Because we're in surgery a lot, we'll have some of our pre-op LASIK specialists, or some of our optometrists or general ophthalmologists screen you to make sure you're a good candidate. Um, at which point they will either schedule you for surgery. But if it was, let's say you saw me for a preoperative consultation, then you get to meet the surgical coordinator or the patient care coordinator who will set you up for LASIK surgery um, at a time that that works for you. Our goal is to be patient centric, and we really try our best to kind of accommodate everyone's schedules. And there's primarily two LASIK surgeons in our practice, myself and Dr. Kubal, who's my brother-in-law. And so it's a large practice, but it's still, we try to keep that mom and pop feel to it. And I think that's super nice. Anyone who's kind of been to a pizza place that was mom and pops, and then seeing it branch out, knows that the taste of pizza just never went back. And that's what we hope to avoid. We really want to give you that kind of mom and pop feel. So after you get scheduled for surgery, you'll come in the day of surgery. You'll have one last check with our senior technicians to confirm your prescription, to make sure that nothing has changed in between. You'll get a quick eye exam with your LASIK surgeon. And perhaps it's a bit overboard, but we like to do that just because things change, and sometimes you just don't know. So at least right before you fire the laser, you get the most accurate, most recent data, and I think that's super important, at least for our team to feel comfortable, because we don't want to be in a situation and said, oh, we should have checked you one more time. I mean, to me, that's not good enough. We need to be better. So we need to know that when you walked in the door, that was what would make you see 20/20 or better. And that's what we were going to use to help program the laser. So we'll check you one more time, and then you'll have some Valium was usually what we use to help the patients relax. Um, Depending, on your size, the dosage would vary. Then you'll go into the LASIK suite, um, and there's two lasers in the LASIK suite. One laser is the femtosecond flap creator, if you will, called the FS200 is what we use by Alcon, and it will make a flap in about 10 to 12 seconds, and so we position the patient appropriately. We'll make the flap in each of your eyes, 10 seconds each, so total laser time's 20 seconds. Granted, you'll be in the LASIK suite for about 20 minutes. Obviously we take our time with our patients, make sure that they're comfortable, everyone else is comfortable. The lasers are kind of primed and checked, multiple times throughout the day. And then after you make the flap, we, that same bed will swivel, and we can see videos online probably and you'll lift the flap using some specialty instruments. Will fire the excimer laser, which is the laser that reshapes the cornea. And that usually, depending on the prescription, the larger the prescription, the longer it takes, but anywhere between 5 to 15, 20 seconds max. And that would be a large treatment per eye. So total laser time, we're talking 20 seconds plus, let's say 40 seconds. I mean, we're talking maximum 1 minute of laser time. Probably less, more like 30 seconds of actual laser time, 30, 40 seconds. Incredible to think, that with that slightest touch, you can change someone's kind of vision forever. Um, so that's the magic of LASIK.
No, that is fascinating how quick it can, your whole vision is just back to like perfect. Like
Yeah.
like you, and I could only imagine from, individuals who have been struggling with that their whole lives and with glasses or contacts or different types of, things that can have happened for them, just to be able to see that. What is some of the things that you hear your patients kind of react or tell you after they get these procedures?
Almost everyone is just thrilled as soon as they wake up. As soon as they get their first nap in, they get home, because obviously something was done to your eyes. So there is some level of discomfort. I've read more blogs than anyone else. And sometimes I read these things, and, you know, the reality versus what's actually happening. I would say that most people do have some discomfort after LASIK. I mean, some level of irritation or discomfort. But after your first nap, you come back, you wake up, you feel like a champ, and for most people, I think it's an eye-opening experience. No pun intended. I mean, it's just incredible. You open your eyes, and for the first time, you haven't had to like reach all over your bed to see if you fell asleep with your glasses half broken between your pillow and your wife.
Is there any specific stories that you remember from any of your patients?
For me, I mentioned military a lot, and so those are kids that come back, years later, and tell you how incredible their vision was for how long. And for me, treating them is something a bit more special. But improving someone's vision, you don't really see that level of happiness in almost any other field of medicine. Um, as you do in ophthalmology. I mean, obviously, if treat someone's cancer and they're cancer free, that nothing can kind of challenge that type of sentiment. But in terms of a young person wanting, something to help them see better, and just like providing that, uh, usually they're elated, and that is one thing I love about being a LASIK surgeon. My happiest days are, going in to see those post-op patients, because knowing full well that everything 99% of the time goes well. I love to go in on it. I do LASIK surgery oftentimes on Mondays. Tuesday mornings, just to wake up, after I work out, I'm like, okay, this will be a great day, because I'm going to get a chance to see these people and see how how happy they are, and what their plan for the next several years of being glasses free feels like.
No, and one of the things that's so amazing. One of the things you mentioned there too was, depending on the occupation of the individual, like these are some of the procedures, with LASIK being specifically what we're talking about, how it can change their careers. What are some of those specific occupations that you have, your patients really benefit from this, that, and how does that kind of play out for them?
Well, for me, I've done LASIK on several firemen and policemen, and obviously for them, it's super super important. You can't be in a situation where your contact is bothering you, or you flipped in your eye upside down, and next thing you know, the duty calls. And those patients are some of the most appreciative and happy patients. But it's not just that. I have friends and family, and patients in general, who love kiteboarding, who love activities, or swimmers, like and outdoors here in Miami. I mean, how many people want to get out to the enjoy a day out in the sun, and do water sports and whatnot. It's not easy. It's it's a pain in the rear end to have to figure out, oh my God, I mean, even as simple as do I have to, I don't know where my glasses, where my prescription, my sunglasses with my prescription is. And something as simple as that. Let's go to the beach today, and we've lost an hour, looking for a friend's prescription sunglasses. And uh, what a nice thing to have to be able to avoid that. Um, in terms of, but yeah, people who are very active outside, this is where they see, I think, the biggest wow effect. Their contact lenses, they don't have to worry about contacts, for the rest of their lives. And we know contact lens use, daily contact lens use is, the cumulative statistical risk of possibly having an infection, or just a sterile like ulcer or chronic dry eye from contact lenses. It's
Tell
real.
us a little bit about the recovery process of LASIK. So, what is that process looking like afterwards?
Right. So, I think we talked a little bit about this, but after you're done with your LASIK procedure, um, you'll go home. The first couple hours are the hardest few hours. So we like to advise our patients to go home, kind of go back to bed, take a nap. If they have some Valium with them, take another Valium. Try to sleep it off, because that first couple hours really helps secure that flap in place and help that the healing process substantially. After that, um, I think that first day still involves quite a bit of healing. You'll have to put your eye drops in, so you have an antibiotic, an anti-inflammatory, and then in between a lot of artificial tears to keep your eyes as hydrated as possible. And then usually 99% of the recovery is within that first 24 hours. By the next morning, you may feel like a mild foreign body sensation. You may feel like something was done to your eye, but I would say the majority, the overwhelming majority of the healing process has already taken place. And so by post-op day one, by the time you're coming in to see us day one, after your procedure, you're feeling pretty great.
Okay. And what is the follow up process? How many times do they come back to see you? What is that looking like?
So they'll typically come back for day one. They'll come back for post-op week one, for a quick check, 1 month post-op check, and that's typically it. Depending on how you're doing, we could see you for a 3 month check, and then yearly checks. If you have your own eye care provider or optometrist that you've been going to, oftentimes we'll have them help us with the post-operative care. Um, but in general, three post-op visits is enough to know how well you're doing. Um, and if things change at all, and you feel like your vision has changed a little bit, we're happy to see you, at any point. I have patients that have come back, years later, asking for an evaluation. Oftentimes, it's not something that went wrong with the LASIK, but another problem that probably occurred. I mean, there are times you have to lift the flap and retreat. With the new lasers, that's very kind of insignificant in terms of the number of patients that actually need to have lift and retreat. A lot of patients often ask me that, do you think I'm going to have something done? I would say if the measurements were super accurate initially, and we are extremely accurate because we check, 3 4 times the average, prescriptions. And if you get good measurements and you have good data going in, statistically, it's very unlikely to have regression. Where we see regression, I believe is when the data is not 100% accurate, or you've rushed someone through the process, in terms of gathering of data. I mean, it's simple, like what goes in one side, black box, comes out the other, and the box is not doing much. The box is not changing. So why would someone regress and someone not? Or, perhaps your body is different. That's one factor. But, assuming that most corneas react similarly, and you're putting in a certain data in, if your outcome is only as good as the data you put in. So I believe that oftentimes when you see, a regression, I don't know if that's necessarily an issue with LASIK surgery, which is extremely accurate, or if perhaps there was something with the patient, but most of the time, LASIK patients are extremely healthy. And so there could be something going on with the preoperative data. And we, like I said, we will not only take the preoperative data that their eye care providers have given us, but we check it once in the office the first day with our preoperative, um, LASIK evaluation, and and then the day of we check it again. And I think those three steps is what makes our regression rates or our retreatment rates super low. And we're also conservative. I understand it's an elective procedure. I don't want someone doing something to me that I wouldn't want to do to myself. I mean, earlier today we were supposed to film a LASIK case, and what happened? We had to cancel the LASIK case because we don't want to do. We're not here. Number one rule of medicine: do not cause harm. So we, obviously we don't want to, but I think that especially as a LASIK surgeon or a cosmetic surgeon, it's extremely important that you take that to the nth degree. And what that means is that, if you see anything that's not perfect looking, then we want to wait and retest. Or we're very conservative. We'll say, I'm not sure if this is the best procedure for you.
And with what are some of the things that our patients need to be aware of and know not to be doing before coming into the consultation or before coming into the surgical process?
Well, first and foremost, if you're wearing contact lenses, we'd like you to be off of your contact lenses. So, for example, if you're wearing hard contact lenses, there's a hard 2 weeks where you want to have the contact removed because the hard contact lens, um, as the name implies, I mean, can reshape the cornea underneath it. So it takes about two weeks minimum for that cornea to look back normal. Uh, if you're wearing soft contact lenses, there's a little bit of wiggle room here. I think to be perfectly safe, 2 weeks is great for all patients. But if you are off soft contact lenses for 1 week, maybe just a week or a little less than a week, most I think clinicians would agree, LASIK surgeons would agree that that's probably pretty good. And obviously, everyone's in today's world is in the time crunch. On a day when you can order Amazon delivery in less than 2 hours. Um, we have an ever demanding customer, and so. Uh, but it's our job to make sure that we keep you safe. So a good LASIK surgeon wherever you are in the country, will probably have you remove your contact lenses for at least a short period of
Is
time.
that pretty much it? Just don't wear your contacts for 2 weeks? Or is there
um,
anything else that you've kind of seen that sometimes happens?
well, I think that you obviously want to follow the fact that you want to have a stable prescription. And generally, your general health is good. You don't suffer from allergies or dry eye. Your prescription is not kind of in the limits where you're outside the general regular zone. Um, Although that, as we talked about earlier, that treatment zone of treatment, sort of in terms of myopia and hyperopia, is increasing with every kind of upgrade on the laser. But that's basically it. I mean, I don't think that there's too much. Obviously, don't stay up all night and think. As long as you're not having any major issue, you can have a consult at any moment.
Gotcha. So when I was starting to prepare for this, there was a lot of questions that I kind of was seeing constantly be asked online, and from I'm assuming patients were asked. And one of the main ones that I saw, was that LASIK is always painful. It's very scary and it burns people's eyes. What do you have to say about that?
I mean, I think that there's some truth to that. Like everything, there's some truth. I think the statement of very painful is definitely an exaggeration. Like I said, I think the first 4 or 5 hours can be um, uncomfortable, and your eyes can burn. After all, we did make a cut in your cornea, and obviously there's a lot of nerves that run through your cornea. So making that cut can be painful. everyone's pain threshold is slightly different. I would say 95%, maybe even higher, of our patients say that there was some discomfort. I felt some burning, felt like my eyes were extremely dry, but they wouldn't use the word pain. On the flip side, yes, there are people whose pain thresholds are slightly different, and there are patients who probably experience a little pain. Um, and for those people, if they know something about their bodies, we can do things to kind of help them recover without suffering. We certainly don't want anyone to go home and feel like, okay, that was the first. Maybe it was only for one day, but it was the worst one day of my life. We don't want that. So we can do things. We can make special drop concoctions and things to help you. So in the end, we want everyone to have a great postoperative experience. But I would say that on average, pain is inaccurate.
And they also talked a lot about burning, that it burns your eyes. Is that the case? Because I think you were mentioning earlier too that the frequency or the type of lasers that we use doesn't actually burn. It cuts them, but it doesn't. Can you talk a little bit?
Right. Well, excimer lasers don't actually create heat, so they don't burn. The it There is a distinct smell that you may smell in the laser suite, but the excimer laser itself doesn't create any heat. It doesn't melt your cornea, so it doesn't burn the corneal surface. Now, if you mean feeling like this feeling of burning, obviously that's slightly different. It's because your eyes are dried out to some degree, and there was a small incision, or like the laser flap was made. So because of that, you can have some burning in your eyes, but the actual laser does not burn. It's a cold laser in many ways, so it doesn't actually create any heat energy.
And then one of the other questions that or statements that I started to see was that all the technology for LASIK eye surgery is the same. So just either go with the cheapest. It doesn't really matter. What do you have to say about that?
I would disagree with that. I think that currently there's still two ways to make a LASIK flap. One is with the femtosecond laser, and the other one is with a microkeratome blade. So there in itself, there's a major difference. And I think that wherever you are, it's important to ask how you're, with what technology you're using to make your flap. If I was talking to somebody, we're in Miami, Florida, but wherever you are in the country, I would say, ask your surgeon that, ask the center that you went to that. There are several different femtosecond laser platforms of three big companies that make different lasers, and they all have some subtle nuances that make one slightly better or worse than the other for a particular patient. But in general, they're all very good lasers. So I think if you go with any all laser LASIK, you're in a good category.
Another thing is people are usually saying that LASIK is not safe.
I mean, that to me is kind of brings a smile to to my face, I guess, because I think it's LASIK is the safest surgery that we do across the board in medicine. I mean, I honestly believe that statistically, LASIK is the most forgiving surgery and safest surgery that we do. So I'm not sure where that kind of gets out. Um, maybe sometimes if you're reading too much into kind of LASIK blogs and getting too delving too deep into to kind of comments from certain unhappy patients that had a rough experience. But if you look at from a statistical standpoint, mathematically, it has to be the safest surgery, if not one of the safest that we do across the board.
No, and I would even add to that from the side of if you have very quality doctor, very well trained, highest technology, and it's already one of the safest procedures just mathematically, it's like a seems kind of like a no-brainer. It's like
Yeah.
if you're struggling with it, if it's something that has been affecting your day to day, it's been affecting you for a while, it changes your whole day-to-day aspect of your life. So it's like, so
I mean, I would say safety shouldn't be a concern.
gotcha. So people also say contacts are safer than LASIK. What are the numbers on that say? Do you know?
I mean, the exact statistics I'm not sure of, but I think as we kind of mentioned earlier, I think that the likelihood of having some sort of corneal infection or inflammation from chronic contact use has to be cumulatively higher than anything the LASIK surgery would be. If we already say that LASIK is probably the safest surgery, and I don't have the exact statistics, but I'm sure that when you add up 10 years of contact lens use, and if you're one of those people that has contacts you have to put in a case, adding another level of possible contamination, uh, I can tell you this: I've spent enough time in the Bascom Palmer emergency room to know that all of the bad things can happen from contact lenses. So, there's no there's no infallible technology. There's nothing that is foolproof 100%. But if I was to choose one, if I was a betting man, I would rather have LASIK surgery than 14, 15 years of contact lenses.
So what would happen if you were to blink during the LASIK procedure or move your eye during the LASIK? That was one of the questions I had a lot of people ask as well.
I mean, great question. Because I would be nervous about that if I wasn't doing it obviously every day. But we put in a device that separates your eyelids, and there's really no way you can create problems. Plus, the laser has a suction. At least the first part of the procedure where you make the flap has a suction on it, so it will keep your eye in place. So it's very challenging to blink or move unless you know jump off the bed, which I've never seen happen. But I guess in theory you could, but it's very challenging to do something wrong. And remember, when it's reshaping your cornea, it's tracking your pupil. So the machine is actually it has an eye on where your pupil is, and depending on the exact technology, the excimer laser can is really incredible. So I've even had patients, unfortunately, move their eyes. In the early part of our career, we thought, oh, okay, well, let's keep a close eye on it. We may need to retreat. Many times the patient comes back seeing perfectly well the next day, and you don't even have to do anything. So,
That's pretty fascinating that even when there might be a slight complication like that, the outcomes are still amazing.
yeah, I'd like to say the eye already is forgiving, but in terms of LASIK, I mean, worst case scenario, almost all of those if you just kind of put the flap back, let's say the laser stops in the middle of making a flap. Um, if all you do is just let the eye recover, you can go back and do the same LASIK procedure on that patient in the same eye in two weeks, but maybe even a month or two to maybe 3 months, worst case scenario, and and things will go perfectly well. So uh, that's one of the most important parts of when I teach LASIK to other physicians. I say if something's not going perfectly well, if you stop and let the eye heal, you know, you can always repair their eyes or fix them up in a way that they'll see perfectly at the end. So the key is not pushing forward. I think as a surgeon, you know, sometimes we feel like we have to do everything for a patient at that moment. Where LASIK is one of those moments where you have to be able to take a step back and say, okay, maybe we'll finish this procedure in a month. And oftentimes, those are the smart decisions that you have to make as a LASIK surgeon. And if you make the right decisions, patients almost inevitably all do great.
Absolutely, absolutely. And can LASIK lead to blindness?
LASIK can't lead to blindness, but LASIK could lead to an infection, theoretically, I guess, an infection. And this we don't see with the new all laser LASIK technologies as much. But, you know, we, we have seen patients, who've had microkeratome LASIK or at the blade LASIK who come in from other countries who have like a terrible corneal ulcer, which we have to kind of fix up. I wouldn't say they're blind, but those patients need a lot of treatment and sometimes need to have, corneal transplant and whatnot. But those are extremely rare. Can it happen? Yes. What is the statistics of that actually happening? It's almost zero. So Uh, yeah, we talk a lot about safety of LASIK, and it's the one thing where I can confidently say it is extremely safe.
Are the results of LASIK instant?
The results of, I mean, I would say they instantly change your corneal shape, but in order for you to actually see very well, you probably have to wait till the next morning, because you need to let the surgery heal a little bit. However, there are several patients who are so nearsighted that when you physically fix that nearsightedness, they're already seeing way better than they were. So they're already starting, the smiles there, that they're already super happy because they saw less going in than they did coming out. But, I would say that the overwhelming, majority of patients really get that wow factor the next morning.
So now we're just gonna kind of go through some of the questions that we were having from some of the followers from all our different social media platforms. And is it possible to have LASIK if you've previously had cataracts done?
It is possible. Oftentimes, if you had cataract surgery and you haven't achieved your goals of your visual goals, we can do a LASIK touch up to help get you there. Oftentimes, in the past, cataract surgery was done, without use of lasers and without the newer technology. So there are several patients who've had surgery 10, 15 years ago who really wish that they could throw their glasses away. And we have done LASIK and PRK procedures for those patients, and that's super thrilled.
I need glasses or my contact lens again after getting LASIK eye surgery.
It's possible in 10 years, 15 years from your surgery to have some sort of regression. But the reality is that the majority of the patients who've had LASIK surgery do not need glasses until they get much older and have cataracts or some other eye problem.
What's the difference between LASIK and PRK?
Well, the difference between LASIK and PRK is one creates a flap on your cornea and treats the middle of the cornea, and that's LASIK. The other is PRK, where you just peel the first layer of the cornea called the epithelium and treat the surface. So oftentimes PRK is referred to as surface ablation. One has a faster recovery period. The other has a slower recovery period. Um, LASIK is better for certain patients, and PRK is better for others.
Should I wear my contact lens before the LASIK consultation?
I would say no. Uh, we often tell patients to not wear contact lenses for at least 2 weeks prior to their LASIK consultation. But if for some reason 2 weeks is a lot, I would say at least 1 week for soft contact lenses.
Okay. What happens during the initial consultation for LASIK?
Initial consultation is really to get to know your eye health, to see if your eye is healthy enough for LASIK, if you are healthy enough for LASIK. Make sure that there's no change in your prescription that's been happening recently and there's no other problems with the eye. And also to see if you fit within a certain parameter that the LASIK laser can operate. Those parameters are very large parameters. So almost everyone is a candidate for some sort of refractive procedure. Um, but however, we really want to just make sure that we do no harm, as physicians. So we want to make sure that we get all the data we need and we're able to pick the right procedure for you.
Can LASIK fix both farsightedness and nearsightedness?
LASIK can fix farsightedness, nearsightedness, and astigmatism, and that's what makes LASIK so great.
How old do you have to be to get LASIK?
For there's two lasers in all laser LASIK. The excimer laser, which is the laser that reshapes your cornea, you only have to be 18 years old. Um, we often refer to that treatment as PRK, and that's why a lot of people who join the military are great candidates for that. The femtosecond laser, the flap creation laser, is approved after the age of 21. So, in order to have all laser LASIK, theoretically, you should be 21 years or older. But there's a procedure for anyone above the age of 18.
Can I go swimming after I get LASIK?
I would hold off on any swimming for at least 10 to 14 days. Probably 2 weeks would be safe because you really don't want to get chlorine in your eyes, or even salt water in your eyes. It could cause you to have some irritation and rub your eyes. If you wear goggles and you're extremely, safe, uh, I think, one could make a small exception, but I would probably avoid any sort of water activities for at least a week or two.
And what about after the full recovery process? Can I go in the ocean?
Oh yeah, absolutely. After your postoperative period is over, you can basically swim, do everything that you were doing, just with the advent of not having contacts or glasses.
And how long is that post-op window there?
2 weeks.
2 weeks? Will I be awake during the surgery?
You will have some Valium or some anesthesia on board, oral anesthesia, but you won't really, and you'll be in a slight twilight zone. So kind of like having a few beers or a margarita.
How long does the entire procedure take?
Total laser time for LASIK is less than 1 minute. So it's incredible. It's incredibly fast. But in our office, between checking in and checking out and 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 going through some extra preoperative testing, you'll probably spend about 20 minutes in the office.
What happens if I move during the surgery?
Um, you know, Aside from LASIK being extremely forgiving, I would say small movements will not result in any change in your vision. So the LASIK has a pupillary tracker, and it does an incredible job making sure that the treatment is delivered with a lot of precision. So I wouldn't worry about slight movements. Now, if you jump out of the bed or something, obviously, there's something we would have to kind of check on.
How quickly can I go back to work after getting the surgery?
You can go back to work the next day. We've had our own surgical coordinators at your eye specialists work the day after LASIK surgery, and they saw perfectly well. In fact, the head of our surgical team had LASIK and worked the next day. Not because we're,
Workaholics?
not because we're slave drivers, but I
Is
guess, yeah.
is there any specific restrictions that you shouldn't do after the procedure?
Now, for me, I think very logically about this. I'm not going to tell you certain things to do versus not do, but you don't want to get your eyes wet. For example, when you're taking a shower, you want to not rub your eyes. So anything that's going to irritate your eyes more, you should try to avoid those things. But you can get back to your regular routine and just avoid getting any sort of things in your eye and allow your eye time to heal well.
How much does LASIK cost?
For both eyes, a bilateral LASIK costs $5,000,
What about for one eye?
2,500.
Is that covered by insurance?
No, it's not. But you could put money away in a health savings account and use that by the end of the year. So a lot of people do that. Some insurances and some employers will have some funds available for LASIK surgery. So inquire from your employer if there's any benefits from your HR department, things like that.
Is it something that I can also finance? Can I finance this procedure?
Absolutely. We offer financing here. Several different financing strategies exist. So I think the most important thing is to come to the office, and our team will be able to help
Cool.
you.
What makes a good LASIK surgeon?
What makes a good LASIK surgeon? What makes a good physician in general? Someone who cares about you to make the right decisions to help you achieve your goals. And I think a good surgeon, obviously, is someone who has experience and who's done a lot of surgical maneuvers, but it's not just number of surgeries. I think surgeries and dealing with complications is important. We spent a lot of time in very busy ERs here in Miami at the Bascom Palmer Eye Institute and seen some of the wildest post LASIK patients and complications. And I think that's what one of the things that makes us so strong because we've dealt with almost everything. Um, and we bring that experience, to your eye specialist. My brother-in-law trained at Wilmer, which is a second, which is an incredible eye hospital as well. And I think you're going to hear from him in the next podcast. But between the two of us, we cover the first and second best eye hospitals in the country, and we bring that. Really, it's not the ranking that matters, but the experience you get from being in those emergency room environments, and we bring that experience here to the community.
No, absolutely. I think between the experience and the education, I don't think there's anybody else that I would put my eyes under. So, absolutely.
Well, thank you.
So will I see 2020 after my vision?
I would say 99% of people see 2020 or better. Will you particularly see 2020? I hope so. I don't like to put numbers on vision, but I like statistics, and I think they speak for themselves. The majority, overwhelming majority of people hit their visual goals, and almost everyone is 2020 or better. So the answer is, will you see 2020? I mean, the stats are in your favor.